Hi, I'm Dr. Mark Scott, and today I want to talk about two thyroid conditions that we see a lot of in my practice: hypothyroid and Hashimoto's disease. Many of my patients have been to multiple doctors treating these conditions. The traditional model of treating these thyroid conditions includes looking at one major marker, and that's thyroid stimulating hormone, or TSH. Whether your TSH goes up or down, that determines the efficacy of the treatment. So if they give you thyroid replacement hormone and your TSH levels go down, then that means that the treatment is successful, regardless of your symptoms. So if you're still having night sweats or constipation, then they'll give you some other type of medication to treat those symptoms. We know that just because your TSH levels are being managed, that you still have a thyroid problem. And why is this? Well, because many of these patients actually have Hashimotos. Hashimoto's is an autoimmune condition where the body is actually attacking itself. So how can this happen? Well, a lot of these patients actually have a genetic predisposition, and certain things can trigger these genes to turn on and start affecting people. Many things like food sensitivities and parasites and chronic stress can trigger these genes, and once they're turned on, then you start having problems. Once those genes turn on, you no longer have a thyroid problem. You have an autoimmune problem. And unless the autoimmune condition is addressed, then you will continue to suffer year after year in a failing system of management. What we do first is determine if you have the signs of hypo and hyperthyroid symptoms. This is classic with Hashimoto's. So hypo symptoms are inability to lose weight, cold hands and feet. Hyper symptoms are night sweats, heart palpitations. If you have both of those types of symptoms, then that's a common association with Hashimoto's. Another common finding is when your thyroid stimulating hormone goes up and goes down. We look at a number of tests to determine the underlying cause of your problem. We look at T and B subset populations. We look at cytokines to determine if you're Th1 or Th2 dominant. The point is that we leave no stone unturned in determining the underlying cause of your condition. And when this is done, the results can truly be miraculous. So thanks again for watching today, and again, continue to look around the site. I know there's some great information here, and I continue to try to update it as often as possible, so check back soon. Thanks.